Alrighty.
I remember.
I know.
I was leaving my stuff on the counter. Oh, yeah.
Okay, so I'm going to go ahead and start a couple of things. Your blood pressure, if you want to know the blood pressure, just touch it and click on the start. And it'll give you a non-invasive blood pressure. It'll pump up and do it itself.
Oh,
Okay, you're getting progressed here.
Thank you.
There's about a 2-second delay between you and me, so pause for effect.
Got it.
Okay? Pause for effect. So, I just ran to my car, sorry.
I would be like so out of breath, so I get it.
I am the PACU nurse giving you a report on the surgical floor of a patient you are receiving out of the OR. His name is Matthias Hedding. He is a 62-year-old male. Came in yesterday with a wound infection of his right foot and ankle. We did a significant debridement of the area. He was under anesthesia for about 2 hours. And at this point, he's awake. He's a little sleepy, but he's awake. He's appropriate. He's oriented. He has a history of diabetes and heart failure. He's visiting his friend here. Actually, it's a cousin, I believe. And the cousin's back in the room. Allergic to iodine, he is a full code. At this point, he has 2 gauze dressings on his foot. They're clean, dry, and intact. There's no drains. He has about a 2+ edema to that foot. Good pulses. Lungs do have some crackles in them. Okay. No JVD. S1, S2, his heart rate's in the 90s. Sats are in the low 90s. Bowel sounds are good. Last bowel movement was this morning. He has not voided since he's been in the OR case. His baseline, he was getting up and just guarded movement with that right foot because of the wounds on there. He has a peripheral IV in the right hand. It is an 18 gauge. He has half normal saline going at 100 mils an hour. Any questions for me?
I don't think so. Kaelin, do you have
We
any
gave him
questions?
pain medication just out of the OR, but he hasn't had any for a while. We gave him fentanyl, and that covered his pain nicely.
Okay.
Okay?
Sounds
Perfect. Thank you. Have a good day, ladies.
Do you know what time it was? She gave him the medicine. All right. I'll ask her. Antibiotics. What do I knock on? Whatever. Hi, Matthias. How you doing today?
I'm doing okay, but I've got my foot sure hurt.
I know you just got back from surgery, so we're going to kind of try to help you take care of your pain. I'm with my Mo, my other nurse who's helping us out today.
Hi, Matthias.
Can you state your name and date of birth for me, please?
Sure, it is Matthias Hedding, and I was born August 14th.
Okay, and do you know where you're at today?
In the hospital. I don't know what room.
Okay, but you know why you're in the hospital?
Oh yeah, I got this wound on my foot that they had to take me to the surgery for. They give me a bad time about it and my diabetes.
Yeah, I saw that. I know you have diabetes. So what we're going to do, I'm going to do a quick assessment. Mo's going to check your vitals, and we're going to try to take care of that pain for you. How does that sound?
It really, really hurt.
Okay, we're going to take care of that as soon as we can.
Matthias, what on the pain scale, 0 to 10, 10 being the worst, what would you rate your pain in your foot?
It's like a 9. It really is sore.
It's bad? Okay.
Are you taking his blood pressure? And
First, I'm going to look at the foot. That's what's hurting, right? I'm going to start your blood pressure here. We'll get you some pain medication, okay?
Oh good, thank you so much.
Yeah.
Oh man, that's really sore.
You're very welcome. All right, I'll go.
all right. Well, she's getting your pain medication. I'm just gonna look at your dressings. They're all dry and intact and clean, so that's good. I'm just gonna.
Cover thoughts of it, though, that really hurts on my toes.
What was that?
The covers hurt on his toes.
Oh, okay. Yeah, we can pull them back for a little bit.
It's hard to
How does
hear.
that feel? Does that feel better?
Thank you.
Where did I find a thermometer?
Better, thank you.
Of course. Okay, I'm just gonna listen to your heart, okay, while she's grabbing that for you. Do you want to just grab his pain meds and
Okay, thank you.
grab his pain meds, and then I'll look for him.
Okay.
And then we can get his pain meds and then just discuss that. Okay, I'm just gonna listen to your heart, okay?
Let's check the order.
Okay, I'm gonna be listening to your lungs. You're gonna take a deep breath for me. Okay, so we got a little bit of crackles. Once we get your pain meds for you, I'm gonna have you take some coughs, but I want you to feel better, okay? Let me see, I'm gonna try to find...
Okay, thank you.
Do you want me to just take his vitals since I'm already here?
That's fine. I can't find the stuff.
The what?
I couldn't find the thermometer. That's
Oh, okay, so we'll find it. We're just gonna try to find a thermometer for you. I wanna make sure your temperature's okay. So you told me you were a diabetic. What kind of foods do you like to eat?
I don't cook, so I eat out a lot.
You eat out a lot? Okay, so do you eat a lot of carbs, simple carbs?
Where's this?
First,
Oh,
yeah,
okay.
I eat sandwiches, stuff like that.
Yeah, sandwiches, lots of carbs. I saw there's McDonald's in here. Do you eat McDonald's?
Well, of course I do. Yeah.
Yeah, their fries are good. But with your diabetes, it's really, the simple sugars, it kind of really spikes those blood sugars. Do you know how to cook? Do you like vegetables? Do you eat any vegetables, broccoli?
Not too much education.
Eat fruit, but it's, I don't know. If they don't have a salad there, then it's kind of, it gives some other options, but not that much.
Yeah.
I'm
It's just good to watch the simple carbs. Just with
Almost.
me, sometimes don't get the fries. I'm going to listen to your stomach sounds, okay?
Definitely. Thank you.
So 2 milligrams.
Yeah. 2 milligrams of morphine. How's that pain? Still hurting?
Oh, yeah, really smart.
Oh, I need a call pad.
I don't know what they did down there, but they did a lot.
Yeah, they had to debride some dead tissue out of there. Do you have problems feeling your feet?
Feeling them? No.
No, not really.
Start feeling them.
Do they maybe seem like a little bit numb or kind of any pain down, like in your extremities?
Oh. Yeah, they do.
Yeah.
I got these new tubes, and I got blisters, I didn't realize it, and that's why I got these infections.
Yeah, so it's definitely good once you get out of here just to make sure that you're looking at your feet and just inspecting your feet a lot, maybe before bed and in the morning. Would you mind if I take your temperature really quick?
No, not at all.
Okay, so I'm going to just put this in the back of your mouth and under your tongue. Is there a temperature on that thing?
What's that?
Okay.
It's on your thing.
The what?
It's on your thing. Oh, because it's not working.
Yeah, no, he's not.
I apologize.
Temperature.
All right, I have the morphine here, Matthias.
All right, so I got your temperature.
Okay.
Where's
Huh?
Sharps?
Sharps? Sharps are right next to the
Oh, goodness, excuse
thing.
me. I'm lost.
So you're gonna grab your morphine. These are looking
Okay,
good.
thank you.
Oh, let's switch sides if you wanna go on this side. I didn't really get the temperature read. Your blood pressure's a little high, but once we get that pain medication, hopefully we'll bring it down a little bit, okay? Your stomach sounded good, so there's some movement in there.
Okay, Matthias, I got some morphine for you here, okay?
His legs have color, so that's good.
I couldn't find alcohol pads, so I'm wiping with this.
Oh, that's fine. I'm just gonna push that right through. With the, where would I find the temperature?
Where would you find the temperature?
Do they
Did it not come up on there?
No, because he doesn't have one.
Makes sense.
Well, man, what's that beeping? I hate those beeping things.
I know, it's the IVs. They like to, since she's
Because I'm supposed to stop it.
she had to pause the IV
Pause
in
it.
order to push the medication through your line or your
Oh.
IV really quick. But they're annoying. They beep all the time at you.
Oh, okay.
There you go. That should help.
I just have to put that.
Oh, that's what I get for putting my lid back on.
Extremities look good. He's looking pretty good.
Okay. They do it again. All right.
Yes, they're funny. How long does it take to work?
It should start to work pretty soon. It only takes a few minutes, and you should start to feel some relief. Okay.
Good. Can you just give it to me real fast?
Well, I can't do that. We have a certain time that we have to put it in, so we gotta wait a few minutes. Okay. You'll get the pain relief you're looking for, though.
Oh, okay. Thank you.
You are very welcome. Oh, stop that.
Stop that beeping.
Okay.
Alright.
Is it starting to feel better?
Maybe a little bit.
Yeah.
Okay. I got a little bit more in here, okay?
Okay. Thank you.
You're welcome. So, Matthias, how long have you been diabetic?
What was that?
Well, I've been addicted to that stuff. Is that an opioid?
It is needed right now to manage your pain of your foot. So,
It is an opioid, but if we use it in
Will I get addicted? Because I've had issues in the past.
have you?
we're just gonna use it in the hospital to help treat your pain. But if it's too much, so when we get to the point where the pain isn't, manageable without medications, that would be ideal. And we will help you kind of realize when
So, Matthias, when you
you
have
don't have to take pain meds.
when you have surgery, the pain is
Okay.
a lot worse. So when you go home and the pain gets a little bit more tolerable, then there's other medications that we can give you to help with the management of your pain that aren't as addictive or aren't addictive. Okay?
Got it. Okay. Well, I don't want to wind up like those people on intervention.
Oh yeah. We're gonna make sure that we
I watch that show all the time. They're hot mess.
we'll make
I
sure
actually like that show too, but
we'll make sure we give it to you if it's absolutely necessary, just to help treat the pain. Once it's manageable, we can switch to something else.
okay, Matthias, I'm going to check with you in just a little bit.
Okay,
And
that sounds like a plan.
I'm going to check with you in just a little bit and see where your pain is at, okay?
Do you feel like you feel a little bit better to take a deep cough for me real quick?
Sure.
All right, so I'm just gonna have you take a really big breath in and then a big cough out.
Oh, I made it beep. Stretch. Reset.
And what we're gonna do, perfect. So we're just gonna try to clear those little crackles at the base of your lungs, okay?
You want me to help turn him over so
Okay.
you
Why
can
do I have
see?
freckles in my lungs?
Just because you just had surgery, you were kind of under for a couple of hours under anesthesia. You weren't moving a lot. When you're not moving a lot, you have little sacs in your lungs, and they tend to kind of close up, and so it causes that crackling. And so what we want to do is we want to open up those little sacs back up, just because you haven't been able to move around for a little while. So with the breathing and the deep coughing and using your IS, we can open those back up for you.
It helps get the anesthesia out of your lungs.
Okay.
Okay, so you want to do this, if you have your TV on, you want to do this. I usually tell people every commercial Okay, so you're gonna take a few breaths on it, and it's actually, it's not blowing out air, it's sucking in air, and you wanna keep this right in between here. That's the key. It's like a little game. Okay, and we wanna get it up as high as we can, and that helps the anesthesia out of your lungs.
Okay.
Okay.
So we'll leave this right on the table for you, okay? And you can use it when you have your
I like that. Thank you.
commercials come on. You're very welcome. Is the pain feeling a little bit better?
A little bit. Thank you.
Okay.
Can I just rest at this point?
Yeah, of course. We're gonna leave. Do you want your feet still uncovered?
Are we done?
Thanks.
All right. So call us if you need us. Here's your call light, and rest, and we'll keep an eye out on you, okay?
Thank you.
Of course.
Oh, did she say she was tired? I can't hear her.
It's so hard to hear.
So I didn't chart that I gave her.
And then we just leave end simulation.
Is I leave before I push that? I didn't check his band.
We checked it when we walked in.
Yeah, but before I pushed.
Are we done?
Yeah.
Do
How
we-
do I get this in here?
What do we do?
You guys are all done.
Okay.
Thank you. I'm already going through things I missed, so.